Thank you, everyone, for coming to Advance's first virtual event. So last time we did this was on the 13th of March, and we were all together. So we'll try and see how we do virtually. Just for those who don't know me, my name is Nicole Scordi. I'm the CEO for Advance. As you may already know, Advance is a charity that works with women and is led by women. So very much focused on women and girls. And our aim is to see a world where women and girls are treated equal and that they lead safe and balance-free lives. We see women and girls as critical in the way that we respond to within the criminal justice system, but we also see them as vulnerable, facing a lot of vulnerabilities. And violence against women and girls very much disproportionately affects them because of the inequality that exists in our system. Today is a piece of research. We're launching a report on a piece of research that is focused very much on young girls. We worked with young women between 18 and 30 that told us about their journey through their early childhood as well as their teenage years, and specifically around their early sexual relationships and how that affected their health and later involvement with the criminal justice system. I won't take very much time other than to say thank you all for joining us. We've already got over 165 participants, so we're very pleased to see you all virtually. And I won't take any more time other than to introduce Sophie Linden, who is the Deputy Mayor for Policing and Crime in London. Sophie has been a great supporter and advocate for all issues around violence against women and girls, as has the Mayor of London, and has really spearheaded an approach that is very much holistic, which aligns with the work that we do. And I just welcome Sophie to this morning and invite her to share her approach and London's approach to women and girls in specifically today.
Thanks so much. Thanks, Nikki, for inviting me, and thanks so much for all the work that's been put into this really important piece of research in this report. Thank you particularly to the peer researchers who've really clearly worked really hard to interview the young women and girls whose experiences and lived experiences are very much they are the report. It's clearly been quite a piece of work and incredibly. I love reading the methodology and the what's happened and the amount of clearly been quite a piece of really important work. So thank you very much to the peer researchers that have put the time in. It's a real honour to join you all today virtually and to have the opportunity to speak to you about the really important work that's been done by the Mayoralty on the impact of young women's early sexual experiences has on their health and contact with the criminal justice system. It's really disturbing that the first sexual experience of many of the women interviewed for this report was as a result of child sexual abuse, non-consensual sex or rape. And that's against a backdrop of 66% of young women and girls experiencing unwanted sexual behaviour in public. And a recent survey of 8,000 Londoners that we conducted showed that 74% of women worried about their safety some or all of the time. And as always, we must always remember that behind the stats and percentages are real people, real women and girls who have been violated in really difficult and sometimes horrific of ways, often in the spaces where they should feel most safe, at school, at home, or in care establishments. And in school, we know that sexist language, unwanted touching, girls feeling pressurised into having unwanted sex prevents too many girls from securing a good education. And as we know, in some cases, this can mean becoming marginalised and can lead to offending. And this is compounded by teachers not feeling confident enough to respond when faced with such incidents occurring. For girls in care establishments, many will have been sexually abused and exploited, and we know that this has a huge impact on their mental health and often draws them into offending. And I know we all agree that they deserve better and they deserve to be protected. The levels of sexual violence faced by so many women and girls in our city is really completely unacceptable. The Mayor and myself consistently made this a priority in the work we do. And that's why, as Nikki's talked about in the introduction, tackling violence against women and girls is a key priority for us. And we're doing everything we can, excuse me, to make this city as safe as possible for young women to thrive and to grow up in. I'm really proud that our Tackling Violence Against Women and Girls strategy will help address some of the challenges uncovered by the report you're launching today. And we're doing this in a variety of ways, including working with schools to encourage positive attitudes and healthy relationships amongst young people, learning and informing best practice across the world through accreditation to the UN Women's Safer Cities initiative, and successfully working with campaigners to put pressure on the government to take action on really awful practices such as upskirting and revenge porn, and helping to fund a groundbreaking anti-stalking unit. The Mayor also appointed London's first independent victims commissioner, Claire Waxman, who's been fighting to help secure better treatment for survivors, focusing on issues such as the appallingly low rate of convictions for sexual violence. But of course, all of this important work must be backed up by substantial investment to ensure that it has the impact needed. In the absence of government support, the Mayor has taken action with a record investment to support services for women and girls, particularly those who've been victims of crime. And that includes £5 million for domestic violence services, over £9 million for services in London's boroughs, and additional funding to keep open rape crisis centres, which have suffered from years of government cuts. And there's been £6 million of investment to support projects which include the Response and Rescue Project, which works with those being sexually exploited through county lines, recognising the unique and complex issues they face, commissioning Safer London to deliver its Empower Young People's Advocate service aimed at reducing sexual violence and exploitation, and funding youth independent domestic violence advocates who engage with those presenting at hospitals who are at risk of sexual exploitation and domestic abuse. We all know that women's offending is often linked to early childhood sexual and physical abuse and the complex trauma associated with it. We also know that informed approaches and single gender environments for women's services can help reduce women reoffending. And that's why the Mayor has invested £4.6 million in 2 wraparound women offender support services, Advanced Minerva and the South London Alliance Female Offenders Project, who both address the often complex needs of women offenders. But success in tackling the impact of sexual abuse on women's offending does require a multi-agency approach. And that's why we're championing, and MOPAC and the Mayor's championed London's blueprint for a whole system approach to women in contact with the criminal justice system. This joined-up approach between statutory and third sector organisations recognises women's distinct needs and reduces the drivers of women offending and reoffending. And the wider Greater London Authority family is also taking the action needed to address these issues, and it is making a difference. London's Violence Reduction Unit, the first of its kind in England, tackles the root causes of violent crime. It's invested £1 million in training healthcare professionals to better identify the signs of domestic and sexual violence, so earlier support can be provided. Karina Wayne, Deputy Director of the VIU, is on the expert panel today, and I know we'll be able to provide you with extra information on the really good work being done by the Violence Reduction Unit in London. And City Hall's Health Department has also launched the Mayor's London Healthy Schools programme, helping over 2,000 schools in London to support their pupils with mental and emotional needs. But of course, we can't talk about all the good work being done without acknowledging the wider context in which we are all operating. Both COVID-19 and the Black Lives Matter movement have shone a light on some of the deep-rooted structural issues around racial inequality that are so prevalent in our society. It's really apparent that many Black women victims of sexual violence lack trust and confidence in the police and do not report when these crimes happen to them, and this leaves them more vulnerable to harm in the future. And I know we all agree that that's just simply not good enough, and the Mayor and I are determined to do everything we can to help. And that's why he's tasked me and London's Deputy Mayor for Communities and Social Integration, Dr. Debbie Weeks-Bernard, to work on an urgent new action plan, which we are developing with community groups and the police to address issues of trust and confidence in policing. But we must do better at ensuring the needs of Black girls and women are reflected in the criminal justice service, and that barriers to coming forward for help and support are brought down. We'll be publishing the action plan in the autumn, and we'll outline how we'll ensure that this happens. I really do take the job of helping to tackle some of the issues raised by the report you're launching today incredibly seriously. And I'm committed, as is the Mayor, to doing everything possible in City Hall to deliver the change that we all know is desperately needed. There's no room for complacency, and we can see that in your report. Some fantastic, really interesting findings from the report. I was particularly struck by the findings around the average age of the young women and girls for their first sexual encounters, and the average age of those that they were of their partners, and the gap and the difference is one that we need to be thinking about, and one we need to be protecting our young women and girls. We really must ensure that young women and girls, regardless of their background, are able to reach their full potential. And to do that, it means we will have to continue to do everything possible to make this city safe for young girls growing up and women, and make it as safe as possible. Thank you for the work that's gone into the report, and thank you for today. It's really good to be with you all. I'm sorry, I always regret not being able to see people face to face. I'm sure we will again soon. So thanks so much, and back to you, Nikki.
I wonder if you're up for a couple of questions. I can see. I can see there's one that's come through about universities, and whether we are approaching universities and investing in universities, particularly London campuses, in terms of preventing sexual violence, and any work that specifically could be done there.
So we've, in terms of sexual violence, we are working with all educational establishments, schools, and I'm very aware that we need to do some more work in universities, and it's something that we need to be, building on in terms of the work that we're doing, because I know that, in terms of young women starting university, it can be a moment of vulnerability, and it can be a moment where we really need to make sure that they are working with us. We are also looking at sexual harassment across the piece in public spaces, not just in universities and campuses, but across the piece. It's one of the commitments that we had within our VORG strategy to try to encourage women to come forward to report sexual harassment.
And there was a question that was put to us earlier around, is there work that could be done within the violence against women and girls sector and the criminal justice sector to respond to young girls in particular, as a prevention and early intervention approach jointly rather than siloed?
Yeah, it's always the sort of that's always the vision, isn't it? To how do we make sure this is all jointly done and not siloed? It's interesting because I'm thinking about it. We need to think about what lessons we can learn from it, because we have invested in 2 prison pathfinders. It's prison pathfinders to deal with the violence in relation to male prisons and young adults in prison. But actually, part of the principles behind that is to look at what happens within the criminal justice service and prisons in particular, and how that impacts the community. And so that type of principle we ought to take for this. It's an interesting point, and I'll take that away and think about how we can work on it. That type of principle is something we need to be looking at in terms of the links between prison, criminal justice service and the wider community. But of course, the blueprint for women's services is absolutely about that. It's about producing that whole systems approach, and that whole systems approach is about, pulling down those silos and making sure all the bits of the pathway or all the bits of the journey are being addressed.
Very much so. Thank you for that. We won't take any more of your time, Sophie, but really appreciate you joining us this morning, and responding back to the substantial investment that London has seen in violence against women and girls approaches, as well as the criminal justice system. I can attest to that as working very closely with you.
It's been a real pleasure. I actually worked in the Department for Education on the sex and relationship guidance that's just been revised from 2001. So it's been a real pleasure to look at what needs to be done in relation to sex and relationship education, particularly the report talking about the need to be really clear that actually it's relationships education and relationships, and that really need to, rather than the physical aspects of reproduction, which many schools focus on. So it's been a real pleasure. Thank you very much.
Pleasure. Right, I will say goodbye to Sophie and invite Summer Alston-Smith, who's our Criminal Justice Services Director, to present the findings that Sophie's alluded to.
Thanks for the introduction, Nikki, and good morning, everyone. Thanks for joining us today for the launch of our report, A Space to Learn About Relationships. My name is Dr. Summer Alston-Smith, and I'm the Director of Criminal Justice Services here at Advance. The research that we are looking at today we were funded by the Greater London Authority through their citizen-led engagement programme to do this study delving into the intricacies of young women's sexual experiences. At Advance, we believe that we're here to work to amplify women's voices, and as such, we invited our advanced peer mentors, women with lived experience of the criminal justice system, to co-design and co-produce this work. So they really led and steered the work that you're about to hear about. And they collaborated with the Greater London Authority researchers to form this research question, to look at the social factors influencing early sexual relationships amongst young women involved in the criminal justice system, and then looking at what the health impacts of those relationships were. This really feeds into our vision for this work. As a service delivery organisation, we see the differences that are affecting girls, young women, and the adult women that we work with. And so we thought this is an important area to look into. Unfortunately, as you'll hear a lot about today, the cohort of very young girls in the system is a small cohort and a hard to reach cohort. So as a result, we didn't get to work with as young an age group as we had hoped to, but this study looked at women's views, women between 18 and 29, which really helped enrich the research, because we were able to get the benefits of women's reflections on their early sexual experiences and the beauty that comes with hindsight. And so we did 23 surveys and had 5 women participate in focus group interviews to scratch the surface of some of these issues. Of course, the scope of the subject was relatively small scale, and we saw this as a preliminary ground clearing study that really, as Sophie said, links in with the work that we know that's happening at the VRU, so their public health approach. And unfortunately, Karina is not going to be able to join us today as a result of a sort of a last minute situation, but I know that they're doing fantastic work there. And we also, of course, know that this all links in with the Mayor's work around the London Health Inequalities Strategy, and of course the London Blueprint, looking at services for women in the criminal justice system. So we thought that and as an organisation, we believe that the relationships that women experience really underpin some of the drivers of their offending. As we know from Prison Reform Trust's research, there's a reason why we're in trouble. So we wanted to scratch the surface on this a bit. And so when we look then at some of the key findings from the project, what we saw was the picture that the woman painted for us was that their lack of knowledge around relationships, their lack of confidence in saying no, and that pressure to have sex at an early age, compounded by a background of childhood sexual abuse and trauma, often led to women ending up in unhealthy relationships throughout their youth and their later lives, many of which were characterized by domestic abuse, which ultimately had an impact on their mental health, and certainly a possible link to their offending, as all of the women who took part in this study had been involved in the criminal justice system. So when we look at the first sexual relationships that women and young girls are engaging in, we found that the average age of the women that we spoke to had had sex at the age of 12. So of course, it really a stark figure that certainly from a service delivery perspective shows us that any services that we're targeting to young women and girls needs to start before this very young age. Girls at 12 were having sex on average with 16-year-old partners, and across the piece, we saw that the young women involved had their first sexual experience of any kind before the age of 16. So 96% of the women we spoke to were having sex before the age of 16. 73% of them said that there were consensual experiences. And on average, the sex that they were having up to the age of 15, under 16, were on average with a 23-year-old partner. So again, as Sophie said, a stark age difference. One of the curious things that came out of this, an interesting thing that we found, was that women differentiated very clearly between sex and the sex that they had within relationships. They also then similarly separated out any abuse that they had suffered, sexual abuse that they had suffered. So it's something that we didn't have the scope to look into further, but there was certainly a very clear delineation between those different forms of sex that women were experiencing. So how did they get to these initial sexual relationships, and what were the drivers for those? And on the next slide, you'll see that we look at where young women are getting their information about sex from. So 48% of the girls that we spoke to and the women we spoke to were finding out about sex from peers that were their age or older. Only 17% of the women that we spoke to had learned about sex from their parents. And while some of them were learning from school, so 52% of them had learned from school, they said that the information that they were finding out about was very biological, very factual, whereas they weren't learning about relationships, love, the very complex emotions and feelings that come from these experiences. So they were left to navigate this on their own. And even of the information that they were finding out, only 50% of them found that they knew enough about very fundamental issues like contraception, birth control, safer sex. So again, tells us that there's a lot more that we can be doing through the school system. And again, this was picked up in a House of Commons briefing in 2018. So it mirrors some of the findings that are happening wider in the field. And as one of our women told us, there was a lot of peer pressure because friends are doing it. It's like, you got to do it. So no one's forcing me to do it, but I felt that everyone was having sex at that age. So I was like, I'll just do it. And that's the approach that the young women reported generally, this sort of a pressure and a push to have sex. And when we then move on to look at in what the women are learning about sex, are they learning enough about consent and saying no? And what we saw was that 57% of the respondents had been pressured into having sex with an intimate partner. The young women felt in hindsight that they should have waited longer. So 74% of them wished they'd waited longer to have sex. And 73% of them felt that they ought to have known more about consent and how to say no. So really just that not having the confidence and the right tools to navigate complex sexual situations. And a lot of the women said to us that even if they had said no initially, after continued pressure, either mental or physical, they eventually are subjected anyway. And of course, interestingly, again, for us, we would identify a lot of those experiences as rape, but the women in this study didn't necessarily see them in that light. So again, shows a lot about perceptions and education and identifying inappropriate sexual experiences. We also then found, on the next slide, very starkly and very sadly, that 65% of the young women involved in this study had been sexually abused, 87% of them under the age of 16. So again, underpinning the experiences that these women have had, they've obviously had very difficult, traumatic experiences, and we didn't have scope within this study to delve in more deeply about what that meant to the woman and how that impacted on things. But certainly what was, again, interesting is that they, as I said before, that there was a clear separation between their discussions around the childhood sexual abuse that they'd experienced and the sex that they reported as part of their later life and sort of what they perceived as consensual sex. Moving on then to look at the impacts that these experiences had. So many of the women reported contracting sexually transmitted diseases as a result of these early sexual interactions, and so left to again navigate a complex world of medical information and stigma on their own as a result of the sexually transmitted diseases that they picked up. Several of the women, also 74% of the women, had been physically hurt by a romantic partner and reported going on to abusive and harmful relationships later on in life where they were physically abused. So there was a pattern of domestic abuse following that many of the women experienced following their early sexual interactions. And then from a mental health perspective, many of the women, even if they hadn't engaged in physically abusive relationships, were in emotionally abusive relationships. So 96%, almost all of the women that we studied, participated, had engaged in unhealthy, controlling relationships later on, where they'd been emotionally hurt by an intimate partner. And one, there's a plethora of ways that these early experiences impacted women's mental health. But two of the main aspects that they conveyed to us was that it really affected their perception of themselves, from having a low body image to being unable to believe in themselves, having low self-worth, which would sometimes lead to promiscuous behavior. Their sense of self and who they were and their self-esteem was severely impacted by these difficult and troubling relationships that they'd had early on. It also impacted their future relationships. A lot of the women said that they felt that they were incapable of love and being loved. They didn't feel worthy of love. Even when caring partners came along, they rejected that affection. And so for some women, they felt that they had lost the ability to feel anymore. They lost the ability to experience emotions in the same way. So again, really deeply impacting mental health effects. And in fact, 91% of the women thought overall their past relationships had created adverse impacts on their mental health. So when we asked the question about whether women felt there had been a link to their engagement in the criminal justice system, only 48% of the women thought that there was a direct link where their previous sexual relationships were a factor in their offending. And of course, as Sophie said, we know that previous research has looked at this and looked at the impact of trauma on women's offending and found a link. We didn't have scope in this study to delve into the links between sexual experiences, trauma, and offending with these women. But we do know that 61% of the women who participated in the study had already entered into the criminal justice system between the ages of 10 and 20, so a very young age. And by the age of 25, when they're still young women, 87% of them had come to the attention of the criminal justice system. So while we hadn't established a clear link, there certainly seems to be some sort of correlation taking place. When we look then at our overall views and we think, okay, from this small scale study, what have we learned? As an organization who works with women, we see the difference and the need for specific work for young women, and we are advocating for bespoke services and spaces for girls. Setting the scene for that will be gender responsive policies and practice for young women within the youth justice sphere. We want to make sure that the policies for youth justice are not just thinking about young boys and knife crime, but is creating a space to think about what do young girls want and what do they need in the wider sense to avoid a situation where they're entering into the world of offending. We think that young women would benefit from safe spaces specifically tailored for them, rather than the issues that older women might be experiencing, making sure that they have welcoming, warm spaces that are the kinds of places that they want to go, that work for them. And within these spaces, that there are specialist services that allow young girls to learn about sex and relationships through trusted adults and peers in a way that gives them the confidence to say no and the confidence to engage in healthy sexual behaviors that they feel empowered to own. Of course, again, we think the figures in the research are pretty stark. The work with these girls needs to happen before the age of 12, before the age of 16. So we really want to advocate for early intervention, early preventative work, and that those services are designed by the young women themselves. So these need to be led by and for projects that young girls and women are shaping, that it can be delivered by specialist advocates, and that they feel that they have had a collaboration to make the spaces and services for them that will work according to their needs. When we think then of the wider community, we are calling for a broader communication, education about these topics. Again, sometimes sex and relationships can be considered quite taboo and things that people stay away from, but we are seeing time and time again that this is important work that needs to be addressed. So at its fundamental, within schools where there's the opportunity to speak to young girls at a very early age, we hope to see more in-depth sex and relationship education that really explores emotions, really gives girls the tools and knowledge that they need around consent, and for boys as well, to understand the broader picture. We also think, based on some of the feedback we had from the women engaged in the study, that if they had access to relationship mentors or a trusted adult within the school setting or within the community that they could go to and talk to about issues around sex and relationships, that would really have helped them and supported them. And somebody to give them the confidence to take these issues back to their partner and then engage in dialogue with their partners. We also think that families and parents would benefit from having more tools and more guidance around sex and relationships. And in general, we hope that for the young women who are in contact with criminal justice services and statutory services from a young age, we know that possibly these girls might be more vulnerable, more likely to be exploited. So we really are advocating for those professionals across the piece, whether it is magistrates, police officers, social services workers, children's centre workers, that they all have training on a gendered approach around how to work with young women, and specifically around and how to broach these issues if the women were to ask them about sex and relationships and how they can respond. Lastly, as I said before, this was a small scale study, but we do think that it's a rich area of research. We can see the ramifications for the women that we work with in the criminal justice service and the domestic abuse services at Advance Run. We can see that these issues are coming up much later on in life, and therefore it begs the question that why aren't we doing more research to really look into the issues around women's healthy relationships at a young age in more depth. And some of the areas that we wished that we had been able to explore, but we didn't have the scale to do so, was to look at the younger generation of girls who we know live in a very digital world, understanding the impact of technology and digital influences on their understanding of sex and their knowledge around sex and relationships. We thought that would be really fascinating. And we also didn't have the opportunity in this study to delve into the impact of demographics, such as the impact of culture, explore the dynamics of same-sex relationships, but we think that would produce really fruitful work. So on that note, I will end with one of the recommendations from the women themselves, who gave us the title of our research, where she said one of the things that would really have helped her was a friendly mentor to talk to about her relationships, not necessarily just sex, but about the very complex world of relationships, and then therefore there should be a space to learn about relationships. And I'd like to just end on thanking the Greater London Authority for supporting us to do this work, the advanced staff and peer mentors who worked on the research, and of course the participants without whom we wouldn't be here today. So thank you everyone, and I'd like to pass over now to my colleague Tia, who is our young women's key worker here at Advance, who will be reading a story today from Naomi, one of the participants in the study and an advanced service user, to tell you a little bit more about her experiences as a young girl. So thank you very much, and over to you, Tia.
So as Summer said, this is Naomi's story, which I'm going to read for her. So she says, at a young age, most of my information about sex and relationships came from the streets. I didn't really have a sex education. When I was in school, your parents had to sign a consent form to participate, and my mum didn't sign it for whatever reason, so I wasn't allowed in the class. I don't actually know what they teach you at secondary school, and I don't even remember being taught about sex and relationships. I was 15 when I first had sex, so I wasn't that young compared to some people, but I think I did it because everyone else was doing it and I didn't want to feel left out. It was peer pressure. I think if I had known a bit more about sex and the feelings and emotions that come with it, then I probably would have waited. I think that's the case for a lot of young people. They just do it anyway, just to get it over and done with, just to say, yeah, I've done it. It's horrible. You don't feel right, especially if it's not the right time and you're just doing it anyway. I remember being in a situation where I didn't really want to be touched, but I allowed it because I thought that if I say no, he will probably just go and find someone else to do that with. My past sexual experiences, relationships, as well as sexual partners, definitely impacted my mental health. I went through a particularly bad experience when I was 16, and after that I did not think very highly of myself and had very low self-esteem, so I would sleep around with anyone who would want me. That was my way of thinking. It was my comfort, and I couldn't meet anyone without thinking they just wanted sex from me. I think it can confuse a lot of young girls and mess them up, because if they do keep giving in the long run, they are not going to feel worthy of themselves. Because, as I said, that anyone who is nice to them or wants to be in a relationship just wants sex, and we will almost just become like a machine or an object. I ended up being in a controlling relationship when I was young, and I was letting him tell me that I can't go out, that I can't wear that I can't talk to that person, which also has impacted my mental health. I think that it was just my mental health, that was it, that led to the offending. I ended up going to prison on remand and finding out that I was 12 weeks pregnant. When I was released, I was 8 months pregnant. This also had an impact on my mental health. I didn't have a good experience, and my whole pregnancy I was worrying about whether I am going to have to give up my child and things like that. Thank God that I didn't, but it was all guilt. In the end, the fact that I was pregnant helped, and I wasn't given a custodial sentence. If there was more help out there and maybe more services that younger girls could go to, that would have helped change things. I don't remember anything back then that I could go, where I could go to and speak about someone wanting to have sex with me, especially if you can't go to your parents, which I couldn't. Groups where you can be comfortable and you can hear someone else's experiences and stories. There could also be people who go into schools and have talks, or like a relationship mentor, someone friendly who you can talk to about your relationships, not just sex, but your relationships too. Like in sexual health clinics, there could be an option to talk to someone about relationships, as there are some unhealthy relationships and young people need guidance around what should be allowed and what is not. Some people stay in unhealthy relationships because they feel that they cannot leave that person. So maybe what is healthy and what's not, what should be allowed and what shouldn't be allowed. And that was Naomi's story.
Thank you, Tia. That was really powerful to hear. I think taking 2 minutes to reflect on a lot of the information that Summer has shared with us before we move on to our panel, and also just listening to the words that Tia shared with us coming straight from Naomi today. The message that came from this piece of research and from, you heard very much in Naomi's story, is that young women and girls know what they need. They know what will make a difference to their own mental health, to their own self-esteem, to their own lives as young girls, and their future as young women. And yet we talk a lot about lived experiences and listening to our service users in charities like Advance. And this gave us a real opportunity to stop and really listen and give them the space and to sit at the table to really design and produce this piece of work and tell us directly, without any judgment, without any preconceptions from us, what it was that they believed in, that they needed, that they, and you can see from Naomi already a lot of solutions about how we could do this differently. So I saw a couple of questions around how many women were in the study. I think someone briefly touched on it, but there were 29 women, and there was a variety of tools used. So we had survey, we also had focus groups and interviews and one-to-one. So there was quite a lot of interaction with what was a small group of women in terms of statistical, but again, as Summer said, they tend to be very invisible, particularly young girls in the criminal justice system, and so a lot of food for thought there that I'm sure our panel will want to explore through the next stage. We're a little bit ahead of schedule, which is great. And so it gives our panel a little bit more time to share their experiences and their expertise, and for you to ask questions, and I can see they're coming through. Please keep using the Q&A function rather than the chat so that we don't miss your questions. but thank you to everyone. And so without a lot of delay, we'll launch into our panel, which are, first of all, apologies from Karina Wayne, who's the Deputy Director for the London's Violence Reduction Unit. Karina had a personal emergency, and so she wasn't able to join us this morning, and she was very disappointed. I know that the London Violence Reduction Unit does an awful lot of work around the youth violence and the youth agenda, particularly with a public health perspective. And it's a shame we haven't been able to hear from them today. However, a lot of our other panelists are able to comment on that and are engaged in work with them as we are. So please do ask questions around that if you don't hear some of that work being shared today. In the meantime, we have today Pippa Goodfellow, who's the Director of the Standing Committee for Youth Justice, Jessica Southgate, who is the Interim Chief Executive for Agenda, Nicole Walsh, who is the Young Women and Girls Service Manager for Women and Girls Network, a partner of Advance. We have Caroline Howe, who is our Policy and National Programs Manager for the Lloyds Foundation. And finally, Summer will join the panel again and give you an opportunity to ask more questions around the research. So I will, the way that we'll approach the next 40 minutes or so, we'll give each of our panelists a little bit of time to either talk through their work and their organization's work, either through slides, there are a few that have slides, or directly. And then at the end, we will take some of the questions before we're joined by our last keynote speaker today, who's Nicole Jacobs, as you already know. So thank you all. And Pippa, may I invite you to switch your camera on?
Thank you very much for having me. I'm delighted to kick off the panel session this afternoon. I'd also just really like to welcome the report. One of the things that has been consistent in my career in youth justice and with a focus on girls and young women has been that there's a real absence of focus, particularly from a research perspective, on girls and young women. So this is a really welcome addition to the evidence base and to get us thinking about some of these issues. So thank you very much for that. So just a little bit about me and my perspective before I kick off. So I'm the Director of the Standing Committee for Youth Justice, which is an alliance of over 60 non-profit organisations, and we work together to try and positively influence youth justice policy. We've recently embarked upon a fantastic project with Agenda, which Jess is going to tell you a bit about next up. But I wanted to start off by just giving a bit of context around the place of girls in the criminal justice system and build on some of my own research, which I've done for the Griffin Society and in my doctoral studies, which is looking at the recent trends in terms of the way that the youth justice system and other agencies have responded to girls that are in the system. And I think, as Summer mentioned in her report, that 61% of girls in this piece of research had actually entered the criminal justice system between the ages of 10 and 20. So this really is a critical period for us to be getting this right, both in terms of what the youth justice system itself is doing, but also what's happening in terms of education, mental health, and lots of the other agencies and supportive services which can be involved in supporting girls at that critical time. And next slide, please. So what do we know about girls that are in conflict with the law and involved in the criminal justice system? Well, it may sound obvious to those that are on this meeting, but it's certainly not obvious to everybody, and not obvious to everybody that are taking decisions on these matters, that girls offending and their routes into offending are different and distinct from those of their male counterparts. So we really need to consider them from a gendered perspective. As I already mentioned, girls are consistently overlooked by research, policy and practice, and there's really an absence of a rich research evidence base that we can look at when we're trying to put the case forward to policymakers and commissioners in terms of them investing in gender-specific services. We know that girls also get differential treatment to boys once they're in the criminal justice system, and that can cause real issues for them, which I'll come on to a little bit later. But one thing that we know is absolutely clear and is definitely synonymous with the research that Advance are publishing today is that girls, particularly girls in custody, but girls in the system in general, have got particularly high prevalence of experiences of abuse, exploitation, and a lack of care from those that are responsible for their well-being. So one of the things I just wanted to go a bit further in terms of that was around the context of offending, very much being around those relational experiences from the family, from interpersonal relationships, from relationships with peers, and these having a really profound effect on girls and their trajectories into the system. And one of the things that I also wanted to mention at this point was the impact that that can have on relationships with professionals, and therefore how we need to really think about what those professional relationships are like in order to really break down some of those issues around trust. Next slide, please. So I just wanted to give what I think is a really fascinating overview in terms of what some of the recent trends have been in terms of the criminalisation of girls. If you can see on that graph there, the girls on that graph are in black and boys are in green. Now this is put together to show the comparison between girls and boys. So it's not overall numbers, it's there to identify the kind of the changes over time. So from 2003, we can see that there was a big uptick in girls offending or the extent to which they were criminalised. And since 2008, there's been a dramatic reduction in the rate of criminalisation of girls. And I think why this is really important is just to demonstrate the differences in the way that the system is responding to girls, and particularly because that period in the early 2000s was when there was a very different approach and a very different narrative around girls who were at risk in general. And that was the period where there was lots of newspaper reports about ladette culture, about girls being violent thugs. And actually what we started to see in the period since then was a real learning by the sector, and as a result of a number of really high profile cases around sexual exploitation, and that we've seen a real reframing of the way that different systems and services respond to girls. And what's happened as a result of that is that the criminal justice responses have really, really fallen off. And we hope that what that means is that girls are getting more appropriate responses. This is also the case in terms of custody. So just to put some context around that, over the last 10 years, there's been a 90% reduction in the number of girls that are sent to prison, which is an incredible change in terms of that recent phenomenon. So there's definitely been a real shift in terms of the way that systems are responding to girls and their behaviours. Next slide, please. So as I've outlined, this really is a neglected area of policy, and what I think that both of the previous two graphs showed you is that where we've got gender neutral policy, so there haven't been youth justice policies that have been specific to girls, despite that huge change in the way that the system was responding to them. So gender neutral policy and practice has gender sensitive and gendered outcomes for girls. And this, depending on the point in time, can be discriminatory, depending on whether or not at that point in time that is seeing increased diversion, or whether or not that's seeing girls getting treated from a more supportive and welfare-based response. Next slide, please. So I just wanted to really end up on going back to a report that was produced by the APPG on women in the penal system back in 2012, which I think sums this up really well, which is that a gender neutral youth justice system based on the risk of offending has the potential to discriminate against girls, particularly when welfare needs are confused with risk. There is a lack of understanding about different needs of girls who end up in the criminal justice system, little evidence of what works for girls, and few programmes designed specifically for girls. So I think that kind of really sums up why this piece of research is really important, why that gender sensitive and gender specific approach is really important, and also the real importance around a focus on relationships to make sure that girls are getting the support that they need in a gender sensitive and safe spaces. So what we've seen in terms of the recent past for girls is that the findings of this report are really pertinent to making sure that we don't see a reversal of those positive trends in terms of their diversion out of the youth justice system. Thank you.
That was brilliant, Pippa, and I know you'll be with us to answer questions following everyone else's presentation. So may I invite Jessica and Pippa, may I get you to switch your video off just for bandwidth, and we'll invite you back in. So Jess is our interim CEO for Agenda, or is Agenda's interim CEO, and she joins us today to talk about the Youth Justice Project that Pippa alluded to just now.
Thank you very much, Nikki, and thank you to everyone in advance and Summer for that fantastic report. As Pippa said, it's really valuable because there is such a dearth of evidence around the specific experiences of young women in contact with the criminal justice system and the issues that they face and what's really priority to them. So it's really great to have seen the peer research methodology used as well. So if we could just go on to the first slide, please. So just a little bit about Agenda. We're an alliance of over 100 organisations across England and Wales, campaigning for women and girls experiencing multiple forms of disadvantage. So we do that through trying to transform services and systems, raising awareness across sectors and promoting political and public understanding about the kind of risks and disadvantages that women and girls face, which can lead to a range of adverse outcomes, including mental health issues, poverty, contact with the criminal justice system, and sometimes homelessness and addiction. We're working with the Standing Committee for Youth Justice, if we can go on to the next slide, through our Young Women's Justice Project, which has a particular focus on young adult women aged 17 to 25 in contact with the criminal justice system. We're grateful to Lloyds Bank Foundation for their funding for this piece of work, which will run up until the end of 2021. And through the Young Women's Justice Project, we're providing a national platform to try and build the evidence base around the particular needs of young adult women and the services supporting them, to try and identify the particular challenges that they face in their lives and what more is needed to improve the response to them. We're taking a particular focus on girls as they transition from that period that Pippa has highlighted very clearly in her presentation, from 17 to 18, both in terms of criminal justice services, but also these wider agencies that they should be getting more support from than they often do at that age. We're also taking a focus on the relationships between girls' experiences of abuse and violence and trauma and their contacts with the system, as well as how that plays out for Black and minoritized ethnic young women and young women who are care experienced. So if we can just go on to the next slide, please. So just a little bit about young adult women in the criminal justice system to build on what Pippa's already very clearly set out. They're a minority on account of both their age and their gender. So in terms of youth services, girls are very much a minority when we're thinking about criminal justice. And in terms of the adult women's justice system, younger women are, of course, a minority there too. So as a result, they're often marginalised, their needs are ignored or misunderstood, and they're likely to have very complex and overlapping needs with their experiences underpinned by early abuse and trauma, poor mental health, perhaps growing up in poverty and other forms of social exclusion. They're also more likely than their male counterparts in the system to have a higher number of support needs, which can lead to their contacts with the criminal justice system, their offending, and their needs and experiences are also different from adult women. They are systematically overlooked in policy and practice, and as Gender and as Summer and Pippa very clearly set out, that means that a sort of gender-neutral policy approach just means that there are gendered impacts on girls and young women. So, for example, the female offender strategy, the women's policy framework make no reference to the specific needs of younger women or what should be put in place for them. And whilst there's specific guidance for young adult men in the criminal justice system, there's no equivalent for young women. And a lack of gender-specific data reporting and monitoring of their outcomes means it's really difficult to identify their particular needs and track what works and what doesn't for this particular group. As well as criminal justice services, the wider support services and spaces that they might well have been in contact with, for example, girls who've been excluded and are in pupil referral units, or girls who might be in mixed and sometimes unregulated accommodation. These are sort of environments that girls also, as well as youth and criminal justice services, can experience as male-dominated, sometimes very risky, unsafe, and often putting them at greater risk of the kind of challenges and problems that might bring them into contact with the criminal justice system in the first place. So many tell us that they feel like a lack of appropriate support that meets their gender-specific needs means that they're left to their own devices, and particularly when they turn 18, they go from having lots of support to suddenly being left to struggle alone. If we could go on to the next slide, please. So thinking specifically about young women's experiences of relationships and abuse and how that plays into their potential contact with the criminal justice system, what we know through the Young Women's Justice Project is that young women have their own distinct support needs, which are often more closely related to their experiences of poor relationships, as well as experiences that are very particular to that age and time. So, for example, recent experiences of multiple exclusions in education, and often recent experiences of having been in statutory care. And as this report, Advances report, very clearly sets out, it also is underpinned by experiences of abuse, coercion in both familial, intimate partner and peer relationships. But unfortunately, these sort of experiences we find often go unrecognised. For example, young adult women's experiences of abuse in their intimate partner relationships are often overlooked on account of their age. And where vulnerabilities are identified, the ways in which they are responded to, young women are responded to, can also be experienced as very re-traumatising and punitive. So, for example, young women in care may describe having frequently come into contact with the police when in care, and those contacts perhaps often experiencing restraint at the same time, being very emotionally distressing, which can lead to further arrest and criminalisation and being caught up further in the system. So we really welcome this report, which helps contribute to this evidence base that we're hoping to build as well through the Young Women's Justice Project. And we hope that it can address some of the really significant data gaps that there are for this age group. In particular, there are real challenges in terms of looking at the intersectional experiences of younger women, and how Black, Asian and minority ethnic women experience the system and the type of support that they need as a result. And we absolutely endorse Advance's recommendation for more appropriate spaces for girls and young women to learn and talk about healthy relationships, sex and emotions, because young women frequently tell us that it's very important for them to have access to those sort of spaces where they can develop a sense of their own identity and develop positive and mutually respectful relationships, often with their peers, in safe, young women-only environments. So we really hope that we're able to take forward these recommendations and our own for making more positive recommendations for good change. And if you'd like to find out more about the Young Women's Justice Project, do have a look on both Agenda and SCYJ's website. We will shortly be publishing a transitions briefing paper about young women's experiences of transitioning from youth to adult services, as well as a literature review later in the year about what the evidence tells us and what some of those gaps are. Thank you very much.
Thank you, Jess. That was really insightful and brings together a lot of the work that's happening around young women in the criminal justice system at an early age. I would like to ask Nicole Walsh to join us. If you can switch on your camera, Nicole. Nicole is the Young Women Service Manager for Women and Girls Network, a partner organisation of Advance in terms of delivering services, who takes a different approach, coming at it from the violence against women and girls sector and not so much on the criminal justice, and bringing perhaps some of the other strands that young women face.
Thank you so much to Advance for that research and that report. It's really welcome here as well at Women and Girls Network. And just touching on a few things that I'm going to cover in the next few minutes. Just wanted to say that it's really great to be here, and especially because of the recommendations that have come out of the report and what we've heard from the speakers already about creating those spaces for young women. I'm glad to say that Women and Girls Network, we do have services that provide that support, especially for younger women. So Women and Girls Network is a specialist organisation that focuses on the experiences of women and girls who've experienced sexual violence. And I am the Young Women's Service Manager who's privileged enough to work as part of the Young Women's Service, which is a multidisciplinary team that specialises in supporting young women's recovery from gender-based violence with a specific focus on sexual violence. So we support young women who are 11 to 25 with counselling, one-to-one advocacy support, which can be for young women who have reported sexual violence and are going through the criminal justice process, or young women who have more practical and emotional needs, and we offer that wraparound support. So I know there's been a lot of conversations around early intervention work and work in schools, but more specifically in primary schools. So we have a prevention strand that works in schools, delivering a whole schools approach. And this takes place in primary schools with year 6 students, secondary schools and colleges. And the whole schools approach is changing the ethos and the values of schools and thinking about the approaches and attitudes and behaviours that further perpetuate sexual violence for young women in schools. Our prevention work also takes place in the community, raising awareness of different forms of gender-based violence and where and how young women can access specialist support. So when we think about sexual violence, it's really important that we have an intersectional framework that we see this from, because young women's experience definitely change and are impacted by their race, their gender, their class, their sexual identity. All of these things play a part into how they experience sexual violence in their world, but also how they access support and how services such as schools or social care or youth offending services refer those young women into specialist services like ours, because there's a lot of structural inequality. We think about how schools and education systems see young women who come from Black and minoritized backgrounds as not as victims or survivors, but more around adultification of those young women and as they are perpetrators as well. So it's really interesting that we're having this talk about young women who are involved in the criminal justice system, but we're not speaking about young women who need to access the criminal justice system for their own justice and their experience of sexual violence, which I think goes hand in hand. So the young women who access services have experienced a range of complex trauma, and the impacts of trauma have varying levels, thinking about trauma from historic child sexual abuse and how that impacts them in their prepubescent ages and also into their adolescent development, but also into thinking about intergenerational trauma and how those varying levels and those various experiences of trauma can impact a young woman's development. However, the impact of trauma has a clear distinction, especially in key development stages of a young woman's life, impacting not only the physical and emotional health of a young woman, but really impacting her sense of self. We see a lot of suicidality in young women. We see a lot of self-harming. We see a lot of internal risk following a sexual violence episode or experience for a young woman, and what those stages mean for a young woman's attachment and her interpersonal relationship. So for us, it's really important that we reimagine what relationships mean to young women and girls after experiences of sexual violence, and how this is heavily influenced by their contextual experience of sexual violence, whether this happens in the home with family members or whether it's extra-familial. So we have a lot of conversations around child sexual exploitation and a lot of conversations around county lines, but we want to think about what are the impacts of that trauma in terms of building relationships in their adult life. So I know the report looks at much older young women than what we work with. I think it's important for us to have that aspect of thinking about what happens to a young woman who's 10, 11, 12, 13, where those are key stages of her development in forming attachments and relationships with peers. So we work from a model called Making Space model, and I think it's really important to highlight that it's called Making Space because the space wasn't there for young women to kind of explore relationships, to explore their trauma, to explore the impacts of the sexual violence that they experience. So our Making Space model was co-produced and co-developed with young women to ensure their needs were embedded in specialist service delivery. The values and ethos that are at core of our model is holistic. We are right space. The work has to be therapeutic, intersectional, trauma-informed. It is a mutual service, so it's not about us being professionals and them being young women. It's about working side by side in their recovery. We are strengths-based. We celebrate rebellion and resistance, and we are feminist and gender responsive to the needs of the young women. So that came out of a research that we done with the Centre of Expertise around child sexual abuse, and it's really important that we continue to have young women's voices in service delivery for the services that they need to access. And I think that's what's came out of the report that Advance have done, is that young women want spaces where they can go to and talk about relationships. Yes, young women see relationships as sex and sex separate because that's the world in which they live in. And I think it's really interesting, one of the findings is about young women consent and saying no. Well, when we deliver that workshop in schools around consent, there isn't a conversation around what is saying no, because a lot of the time these young women are not asked the question where their response is going to be no. So those are the kind of contexts in which sexual violence happens for young women. It's not necessarily in the midst of a relationship. There is a wider context into which sexual violence happens to young women. So once a young woman has come into the service, we really want young women to see relationships in a positive way, whether this be with their peers, other young people, or their support network, and having those trusted relationships. Often, after a young woman has disclosed sexual violence, her life is shaped by risk-averse interventions, safety plans, continued risk assessments, which are definitely valuable tools, but at the same time, it's important to celebrate the resistance, resilience, and powerful, positive relationships in her world. Our work needs to be able to disrupt relationship patterns of power and control and focus on post-traumatic growth. Young women often tell us they want to celebrate love, solidarity, connection, and relationships that soothe young women, and this should be normalized in her recovery. It is known that social engagement can definitely reduce the impacts of trauma, and until we see relationships from this lens, we continue to perpetuate the stigma that young women are held accountable to the violence they are subjected to. So just the key things that I want to leave you with is the importance of having a model that has young women's voices involved, the importance of making space for young women, the importance of a gender-responsive, trauma-informed, intersectional framework, importance of how we reimagine what relationships mean in preventative work that takes place in schools and community, but also into advocacy work that one-to-one support, and the importance of young women and celebrating their resilience, resistance, and recovery in trauma-informed spaces, but more so in policy, research, and legislation. And until we can get those things joined together, and I think we had a conversation about how do we get the VAUG services and the criminal justice services to work more closely together, until we get that, I think there is still going to be that kind of grey area of how does that work jointly in terms of supporting young women who are involved in the criminal justice process, but also are survivors of sexual violence. And that is me.
And that was super powerful, Nicole, and really important, bringing forward a service perspective, a service delivery perspective, where Jess and Pippa have talked more around policy and research and the realities on the ground of what women are and young women and girls are telling us and their experiences and their perspectives as opposed to perhaps us as professionals or as organizations that are experts. So thank you for that and for giving them the space. I would like to perhaps ask Caroline Howe, who is the Policy National Progress Manager for the Lloyds Foundation, to give us her perspective on what can commissioners and funders do to support the work and the framework around working with young women and girls.
For those of you that don't know us, Lloyds Bank Foundation, we're an independent charity funded by Lloyds Banking Group. And we support small and local charities tackling complex social issues across England and Wales. So working in issues like domestic abuse, criminal justice, mental health, refugee and asylum seekers. The report obviously reflects a lot on the need to focus on healthy relationships. And I think this is something that resonates with us in terms of the work that we've been doing with Lloyds Banking Group, so our corporate donor, around domestic abuse, where we've been bringing together the expertise from our grant holders, who are small and specialist charities, domestic abuse charities in that case, with the bank to look at how they can improve their response to domestic abuse, both for their colleagues and for their customers. An important part of that work has been recognising that domestic abuse is not someone else's problem to deal with, and that within our own workplaces there are survivors and perpetrators, and we all have a role in responding to that. And that in terms of thinking about healthy relationships within this context has been driven by the high number of young people that are employed by Lloyds Banking Group, and that thinking further upstream is necessary if we want to prevent future victims. I think this is particularly important at this moment in time when so much is understandably focused on picking up the pieces, which is what so many of the charities that we're funding are having to do. So even before COVID started, our kind of 650 grant holders were telling us that demand was going up, it was getting more complex, so taking more time to help people with the challenges they face. And at the same time, funding was harder to access. We were seeing local authority money diverted from prevention to crisis, with more and more problems pushed further down the road. And now we've got the pandemic response to add into the mix, where so many services and people have had to pivot their support to meeting immediate needs. At the same time, we know that the threshold to access support has risen in many cases, with a focus on the most extreme challenges. And that might be because of spikes in demand, lack of funding, or lack of access to services at this time. And in the domestic abuse space, we've seen grant holders report fewer lower and medium risk survivors accessing services during lockdown, with a growth in demand for services focused on the highest risk, at the same time as knowing that overall incidences of domestic abuse are still rising. So while it of course is important to meet these high level needs, it can't be at the expense of reducing the problems in the future. In the example that I just gave, we know that many domestic abuse homicide cases involve people who are classified as low or medium risk. So it's important that we can still address what might be seen as lower level needs when they're still at that lower level end, because the consequences are obviously severe if we don't. So we need to be responding to immediate needs as well as looking at how we reduce the challenges that people face in the future. So whether that's about influencing systems, and Jess alluded to the project that we're funding in terms of trying to get the experience of young women and girls pushed up the agenda, whether that's about providing different types of services or indeed education, we need to look at how we stop challenges from occurring in the first place. And we say there's not just a moral case for this in terms of the human cost that's at risk, but also an economic case, as it costs less to prevent a problem than to deal with the aftermath. But as well as looking upstream, I think we also need to look sideways. And I'd say that addressing these issues can't just be left to the women and girls sector or those who specialise in specific issues. We need to look across the piece because, as has been mentioned throughout this morning, challenges don't normally arise in isolation. We also can't ignore the role of men and boys in this space, as often the ones who cause harm. So we should be looking to build links with other sectors who are working with these people, whether through charities working with young men caught up in the criminal justice system or youth charities focused on young men and boys, for example. There's obviously been an increase in awareness of domestic abuse being everyone's business, especially as a result of lockdown. But it feels like there's still quite a way to go for other services, such as sexual abuse, whether in terms of public or political recognition, or the funding that's available. But the challenges that people face aren't siloed, so our response shouldn't be either. We need to keep looking to build new alliances so that these issues get the attention and support that they need. And we need to look at the whole person, not just individual services. I mean, I think that's something that we're really conscious of as a funder, that we are supporting services that are holistic, but that we're not just supporting services to deliver essential services. We're also providing funding to support organisations to try and change the systems, link up services in different ways and find new solutions. And that's me.
Thank you so much, Caroline. I think it's quite important to bring all of these strands together in terms of domestic abuse, sexual violence, young women and girls in healthy relationships, and the criminal justice system, and approach young girls and young women as a whole person. And as Nicole rightly said, there's intersectional aspects to it. And I think the Lloyds Foundation is one of the commissioners and funders that are able to really fund projects that are right through the Vogue agenda, including the criminal justice system. And that's quite an important principle that we would really encourage commissioners and funders to bring into their policy. For as long as we separate those aspects, then we're not really addressing the root causes. And very rightly pointing that focusing so much on crisis intervention has meant that we've neglected, as it's evident, the early prevention and early intervention aspect of the work, and really neglecting young women and girls. So thank you for that. Summer, I know that you have some additional points to make, but at the same time I'm thinking that we have 8 minutes, and so we've made up for a lot of the time. So if you're okay, perhaps you can make those points as part of the questions and answers, because there are some good important questions that it would be good to address. So if I skip some of our slides that Summer was going to talk through, and get all of the panelists to switch their cameras on, and I'll put some of the questions. Thank you, everyone. So I will take the first question, which is sad. Somebody, I won't use names, who is asking the question, I'm 60 and the sad story of being pressurized to have sex is something that has been going on for a long time. Have enough things changed? What will it take to make bigger changes in the system? So perhaps I could ask Pippa and then Jess to give us some of their thoughts around that.
Yeah, sure, I'm happy to kick off in terms of that. I mean, I think we're talking about long-standing systemic sexism. We're dealing with lots of inherent discrimination systems at the moment, and I think that women need to be represented at every level of decision making, and to make sure that women's experiences are absolutely embedded and central to policy. So I was talking from a kind of youth justice perspective, but that sits within the context of a whole arena of economic and public policy, which is still gender blind, essentially. So until that changes, all of the changes that we're doing at a kind of practice or a policy level in our own areas are going to still be sitting within a broader context of systemic sexism and discrimination. So women need to be represented in every arena of policy and decision making, and at the highest level, to make sure that these questions are getting asked in cabinet meetings and at international conventions, rather than just within sectors that aren't kind of necessarily linked up together.
And Jess, anything to add?
Yeah, absolutely. Totally endorse what Pippa just said, and just add to that in terms of we see so rarely a gendered focus taken in any area of youth policy, and they're all incredibly siloed. And unfortunately, it means that we're looking at areas, even where we know girls and young women are disproportionately affected, like mental health, for example, or violence against women and girls, where there is still a resistance to recognising the discriminatory way in which they might experience systems and services and society. And until we can embed a real gendered lens across all of our policy making, it means that unfortunately everything will be set up without taking that kind of lens into account.
Yeah, as you say, systemic inequality runs through all of the responses or lack of responses at the moment. And so moving on to the next question, and I think perhaps one for Nicole. Girls and young women in the study were victims absolutely before they were perpetrators, so both. And that's what we see often in the criminal justice system. What might be the role of counselling in a safe space, either in schools or in youth services? And Nicole perhaps can talk a little about the work that women and girls do around therapeutic services.
Yeah, so I think there's a lot of work that can be done with counselling in terms of looking at the internal safety of young women who've experienced trauma, maybe from a very young age, where they can't necessarily identify where that trauma came from, to looking at the external safety and creating space for young women to explore their relationships, to explore their identity, to explore their sense of self. I think with young women that are engaged or on the perpetrator end, if you want to use that language, of criminal justice, we've got to look at the roots causes of that, and those are always coming from a systemic place, and thinking about the intersectional approach to that. What can we do from a very early age to support young women emotionally to deal with the trauma that is happening in their communities and their environments, but also how can we support them once they're in education systems and kind of dismantling those systems of oppression for them to live fulfilled, happy lives that they just want to live.
Yeah, and just picking up on another question that follows on from that, and open to the whole panel to respond to that, around mental health services and mental health issues being non-gender specific or being very generic. What's the panel's experience in terms of engaging mental health services to responding to young women and girls in a gendered way?
I can come in there if that's all right, Nikki. We've done some work around the degree to which mental health trusts take a gendered approach, and submitted a Freedom of Information request to find out whether mental health trusts had gender-specific policies and practices, and whether they were routinely asking about experiences of abuse and violence. And despite the fact that we know young women, particularly 16 to 24, are the most at risk of experiencing common mental health problems, a very, very small number of mental health trusts have any kind of strategy that particularly tackles the mental health needs of women and girls. And similarly, very small numbers have specific policies on asking about experiences of abuse. So we know that 50% of women who've experienced abuse or who are in mental health services have experienced abuse. So this very clear connection just isn't being made, which is why we're asking within the domestic abuse bill and also within the comprehensive spending review that needs to be made a priority. There needs to be a duty for public services, including mental health services, to be asking about those experiences and really getting to the bottom of why women and girls are experiencing the problems, including mental health, that they do.
Mm-hmm. Can I just add to that as well, in terms of mental health services more broadly? So something we've seen consistently across the charities that we're funding, across many different issues, when they're talking about a rise in complexity of demand, so many of them are pointing to as a cause of that as being a lack of mental health support for people in the community, and the thresholds for that support rising. And so how that is kind of adding all these extra challenges for services themselves, meaning that the kind of risk assessments that they have to do and the way that they deliver their services is all having to change because there just isn't enough support through statutory mental health services.
And it's our experience too, in terms of the wraparound service where a lot of the women, the majority of the women, have mental health needs as well as problematic substance users, and we find that that's often a barrier to accessing any support and service. So again, a very siloed approach from the system in terms of responding to women. One of the questions around supporting and working with young women either in custody or on supervision from the age of 15 or up to 18, and perhaps you want to talk a little about that and working with young women and youth services.
Yeah, and thinking about what can we do to support young women in custody. I think if we take it back a step, really, is then, as Nicole just said, why are we sending young women to custody when we're labeling them as perpetrators? Is that really the right environment for them, given all of the issues that we can see that are at stake? Will a custodial setting ever address those issues in the sort of warm way, that the sort of kind, person-centered, holistic, non-judgmental, trauma-informed way that we all want to work with women in the community? And I'm not sure whether that work can be achieved to a great standard in a custodial setting just by virtue of the fact that it isn't designed for that type of work. And, you know, one of the things that we certainly have learned, we're at the beginning of our stages of this work with young women. We Advance takes a holistic approach that looks at working with women according to their needs and taking a multi-pronged approach. And in that work, we've realized that women's identity is huge in that, and the various intersectionality of all of their elements of their identity, including age, is key to how we do this work. So we've been leading on young women's work within the criminal justice services with our young women's key worker, Tia, who you met earlier, and also on our domestic abuse side when it comes to our, we have our children and young women's independent domestic violence advisor. But certainly one of our principles is looking at systems change, and at Advance, we are trying to come at this to look at solutions for these young women from the lens of the girls and the young women themselves, not the lens of the system. Because if we keep trying to create solutions within a broken system, we're never going to get there quick enough and efficiently enough to create the very urgent solutions that these girls need today, right now, to get their life off a almost inevitable one-way track. We want to get them back on track to live safe, violence-free, crime-free lives. And we think that adapting the system and sort of forcing the system to make space for women and young women is the only way that we're going to be able to do that effectively. So, I mean, unfortunately, the system is what it is. We do have custodial settings. Unfortunately, young women will be sent there, but I urge all of the police officers and magistrates and judges that come before that decision to think about whether that's the adequate route for young women to be served properly, or whether they're better served by services in the community like our diversion project that we currently have with Metropolitan Police.
And I think Pippa wanted to come into that, and unfortunately we're running out of time. So Pippa, if I can ask you for a final word on that, and then we'll introduce our next speaker.
Yeah, it was just in relation to under 18-year-old girls in custody. There's now, partly because of COVID, there are now less than 20 under 18-year-old girls across England and Wales in custody. There's no strategy for girls in custody, and actually there's no strategy for girls in the youth justice system. They don't appear anywhere in any plans or strategic documents. So we're not going to get it right for those girls and make sure that those numbers stay low, or indeed meet the needs of the girls that are in custody effectively, if they're not being thought of specifically and in terms of their specific needs. And I think it's quite shocking that even though they're very small in number, that seems to be the reason why we don't even think about kind of what the strategic plan is for them. So again, they need to be in the conversation and considered specifically, or considered at all.
Very much so. I will not follow on with any more of the questions, even though there's some really powerful ones, and hopefully perhaps Nicole can answer a couple of these, particularly around intersectionality and working, empowering communities such as Black girls, or as we talked about, same-sex relationships and so on. So without further ado, I wanted to thank all of the panelists for both sharing their expertise, huge expertise, and also answering some of the questions. At the end, I will share some information on how to access both the information and report that we shared today, but also organizations that might be that are contributed today. So thank you to all the panelists. I will ask you to switch your cameras off, if I may. And without further ado, introduce Nicole Jacobs, who is, in my eyes, advanced herself, but now our domestic abuse commissioner for over a year, I believe, Nicole. So congratulations for being our first domestic abuse commissioner in England and Wales. And yeah, I won't do anything other than let you speak, because I'll gush otherwise. So there we go.
Thank you so much for having me. And I have to explain to people listening why Nikki would say I am advanced. So advanced was the first place I ever worked when I came here over 20 years ago, and it is kind of in my heart of hearts a place that I always look to for really incredible innovation over the years, and today is just one great example of the work that Advance does and the team there. I came over from the US to London a little over 20 years ago. And Advance at that time was just getting started. In fact, when I came to Advance on my first day, it had been running for about a month. And there were, it was a small room with one other worker. And I think it's a testament to Advance. And if you think of the breadth of work Advance is doing now, and the kind of leadership they've shown over the years, that's something that I think we should all admire. But I also want to say that so that we all can think about just how much our systems and our thoughts about domestic abuse, wider issues in relation to violence against women and girls has changed over the years. So while we all share obviously huge frustration in what is not there and in the cracks in our system and the lack of foundation, I do think, I mean, I'm pretty old, but 20 years is not a long time. It's a long time to wait for the kind of things that we know we need. But I do think it's a good reminder to realize kind of where we've been, what work has gone into kind of getting us where we are now and where we need to go. And I think this event today is just such a great reminder of where we need to go and why we need to rely on the kind of experts like you have at Advance and Women and Girls Network and Agenda and others, who you've heard from today, about why we need to listen to those voices and those experiences and really true experts in terms of knowing what they're doing and knowing what services look like day to day. So a huge thank you to Nikki and team. And I think this report is really incredibly important. And the discussion that I just heard with the panelists was just extraordinary in my mind, in terms of just understanding kind of in depth what the policy and practice and all those interrelated issues are in terms of funding and partnerships. I also just want to say thank you to MOPAC and to Sophie Linden and the team at MOPAC, because I just think we should also just admire, you know, Sophie wasn't trying to do this, I'm sure, but she listed off just quite a lot of innovation and progress over the years from the mayor's office. And I think that I just wanted to say thank you, and thank you for hosting this event. And I'm sure that there'll be people from MOPAC listening today, hearing the discussion and thinking again of the next agenda and the next steps, and how we need to build this much more holistic approach, what I often call, from my days at Advance and my days at Standing Together, the coordinated community response. And that's very much the idea of, in the kind of paradigm that I bring to the role of DA Commissioner. This idea that we have to have specialist services in the center, voices of the survivor in the center, really driving our responses. And we need to have a high expectation of every aspect of the community and our services, statutory services, as a thread running through all of what we do, because that's the only way for an issue like domestic abuse, as we've heard so many examples of today, to really get to where we need to be. But that is hard to do. And what is hard to do about that is amazingly what's been pulled off today, which is to work in frontline services, and alongside that have the support and funding and acknowledgement from others that we need, voices from survivors, and often via the frontline service, to really be driving our thoughts about policy and our thoughts about change. And that's what I really love about today's event. I want to talk a little bit in my short time with you, just to introduce you a little bit, if you've not met me before, just a little bit about my role, how that ties in my mind to what we were talking about in terms of change, having a gendered conversation in a lot of policy spaces, tying up work in silos, all of those things, and how I think we might be able to contribute to that from my office. But I also want to highlight some opportunities, some things about our DA bill that is headed to the House of Lords shortly, and then just explain a little bit about my work going forward and how I would hope to kind of work with you very much to really move the agenda on. So I was, as Nikki said, appointed a little over a year ago. I was appointed as a designate. So part of my role and the statutory underpinning of my role is in the domestic abuse bill, which is headed to the Lords. And in the bill, among other things, it gives my office a statutory underpinning, which essentially means that some of the power of my office will be to ask public bodies for information. And I think really that will help us be able to drive much more assertively and maybe more quickly to kind of areas where do we need to see progress. Jess really excellently pointed out the work they've done recently on in mental health trusts and understanding practice there. That's the kind of thing I think the powers in my office can really help us with, which is really thinking about what is the information we need to know, what data, how does that help drive both government at the national and the local level, influencing other funders who play a really significant role in this space, as you've just heard from Caroline, and thinking about what is it that we need to know in terms of much more precision about where our gaps are. So that's really, in my mind, moving from, examples of excellent services to more common, making those more common elsewhere. And the way to do that is to be precise about what do we have and what don't we have, what's happening, what's not happening. Let's drive and really kind of focus our strategy, our support, our funding in those directions. I'm also able in the bill to make specific recommendations to government, and that those recommendations would have to be responded to within a certain number of days. So that's, again, another really great aspect of the role, and something I really welcome, so that, again, we can be more assertive, more focused on change more quickly, I hope. And so I've been in post for the last year as a designate, pretty much, I think, functioning very much in the same way I would, but without those formalized powers, but really getting to know government, really getting to know particularly some of the possibilities within government that you've alluded to earlier, but also some of the kind of current deficits, some of the things that need improvement, some of the siloed ways that government works itself, which is not helpful to the sector, and really getting up close to those arguments. So I'm not party political, I'm independent of government, but I'm there. I've been put in post by the government to both advise and hold to account, and that's exactly what I intend to do. So that's a little bit about my role, and we'll be undertaking some mapping. We're already getting on with that, because ultimately the role is set out very specifically in the legislation to say, in in areas, what does good look like? And that sounds very easy, but again, using our discussion today is a great example. You know, what good would look like 20 years ago, 5 years ago, 10 years ago. It's in our sector and in our way of working, it is evolving. And so, you know, sitting here listening to Nicole, for example, speaking about what she's doing, I was kind of madly taking notes, and I'm sure I'll be back in touch with all of you, because that is a great example of what good looks like, what the criminal justice services at Advance are doing right now are great examples of what good looks like. So what we have to do is figure out together, how do we not lose these really important aspects of survivor voice, the kind of co-creation that Nicole and others were talking about, and really helping to drive change and seeing some of this exceptional practice in so many other places. So that's a little bit about my role. I just want to take a few minutes while I've got your attention to talk to you about some opportunities that are really right in front of us that you can all be a part of impacting. One is the DA bill. So Jess talked about a really important amendment that her organization and a few others have helped develop, which is about asking and taking action. So this idea that in legislation, we have an opportunity. It's not currently in the DA bill right now, but why wouldn't it be, to say, why wouldn't we want to have a statutory expectation that public bodies ask and are able to take action, set themselves up in such a way that they are able to do that. It seems very simple, but as you heard from her talking about some areas of work, we know that is vastly inconsistent. So I would really like to encourage you to think about some aspects of the domestic abuse bill where we could improve it. So it's headed to the Lords, and there'll be real challenges for the government to take on some of these things. Another is about expanding our notion of what should be covered in the statutory duty. So right now, the domestic abuse bill covers refuge provision or safe accommodation. That's excellent. It's long fought battle won, which is a great step in the right direction. But what could our services look like if we had a statutory duty that would expand to the services we're talking about today, to all of the services, for example, that Advance run, all of the really critical outreach, co-located specialist services, domestic abuse services in frontline health and housing settings, and all the core work that we do in the community or that Advance does, and so many others. So that's currently not in the statutory duty in the bill, but it could be. It's a choice that government is making now, and it's something that we could be getting in touch with legislators about. Another one I wanted to say is that is highly relevant today is a couple of amendments about women who are charged with crimes. And the Prison Reform Trust has done really excellent work, really working up amendments and talking very actively with government. And I really support these amendments, which are about greater protections for when women are charged with crimes, where part of that offending is due to coercion and control and domestic abuse. And so, again, given all that we've heard today, I mean, if there was an obvious amendment for us all to really share an interest in, it is that one. And it's one that I'm afraid isn't getting enough attention it deserves in discussions with legislators and certainly within government. There seems to be a resistance to this. So I would really encourage you to really think about, in the next very short time, few weeks, to be really actively getting involved in that. Another one that's quite relevant to what we've talked about today in the research that Advance has done is threats to share indecent images. So we have, again, an opportunity in this bill to change it so that it would include that as a specific offense, and that would be an incredible step forward, and I think would really impact the lives of many of the people we've talked about today, and some of the context that we've talked about that young people and all women, frankly, are living with in terms of those kinds of threats. running alongside the bill is a statutory guidance. And I know this sounds, I think when I was working frontline, I might have all glazed over a bit about a lot of these things that are happening. But again, I can't stress enough how this is our opportunity to shape a statutory guidance that sits alongside the bill. We've not had this before. We've had guidance in pockets, bits of guidance that relate to domestic abuse in, say, child safeguarding guidance or other types of guidance. This is about drawing all of that together to say what's not in the bill, what doesn't require legislation, but we expect you to do it, will sit in this statutory guidance. So hugely important that all of the amendments I've talked about would be taken seriously and potentially changed in the bill. And if not, somehow very strongly reflected in our statutory guidance. Because further down the line, what I think about the role of my office and what we're able to do in terms of mapping services, thematic reviews, making recommendations to government, and working with you about that, is that will heavily depend on the kind of foundation we set in this piece of legislation and the statutory guidance that runs alongside it. Another huge opportunity that we'll probably see announced very soon is inputting on the next version of the cross-governmental strategy for violence against women and girls. There are some talks, I don't agree with them, but there are some talks about potentially having a separate domestic abuse strategy, kind of interlocks with a wider VOG strategy. All of you will know that for the last few years, we've been operating under a violence against women and girls strategy, so we can see all of the interconnections. But no matter what we end up with, there will be a consultation that you would be able to input in terms of what you want to see in that strategy and what direction the government should take. So again, that sets out priorities for our civil servants and for public bodies and for our government departments. Obviously, alongside that will come funding and priority and attention. And so what goes into that strategy is incredibly important. So again, what we're talking about today and so many other things where we have huge gaps in our systems in terms of underdevelopment, huge silos in the way that we work. It really matters how that gets into our VOG strategy. And obviously all of that, just coming back to the role of my office and the ambition I have for what I'm doing, but also my team and how we work alongside you, is to really think about how in the conversations and the opportunities that I have day to day, making sure to really push those conversations along and assertively as possible and really break down some of these barriers and silos we've talked about. I can only do that if I understand the best of what's happening and the best of the information out there. So I can guarantee you I will be saving this agenda and I'll be wanting to talk to each and every person who's talked today. But I would just say for those of you who are listening who haven't been able to share what you're doing, what your thoughts are, please be in touch. I'll put my information on the chat. And I really want to really get across that my office is only as good as my communication with people who are interested and expert and working day to day as you are. And so I really thank Nikki and her team for all of the work they've done again and the opportunity to be here and share a little bit with you about how I see the connection between this discussion and some really key opportunities ahead of us and some opportunities in my office where we can all work together. So thank you very much for the time, and a huge shout out to the advanced team. Much love to you all. And it's incredible to think where you are now as compared to my little one-room office all those years ago. So thank you for having me.
Brilliant. And I'm really missing the applause here, Nicole. So because we're all muted, I felt the lack of that right through all of this because of all the excellent contributions from everyone, and as always very thoughtful from you. We don't have a huge amount of time for questions, and so perhaps that's something that we could share after the event, but I wanted to wrap up perhaps in the last 5 minutes and bring some thoughts together of some of, as Nicole said, the excellent contributions from everyone, from Sophie and what Linden is doing, to our research, to the presentations of the panelists and discussions, and thank you to everyone for the questions. And finally to Nicole. I think as I was listening to this, along with the over 200 people who participated today, I was reminded of a number of things that are easy to forget, particularly if you're in the sector, as we keep calling ourselves, and experts, if you want to think about that. One is that we refer to young girls and women in the criminal justice system as the minority, and small in numbers, and they are smaller in numbers, but women and girls, and particularly young women and girls, are not small in numbers in our society. They're 50% of them. So it's a good thing that we see small numbers in the system, but we are still seeing a lot of them, the majority between 25 and 40. And so we are missing it's good that they're not entering the criminal justice system in vast numbers before the age of 25, but they certainly are after that. It took the Corsten report, which is now over 13 years ago, to highlight that the criminal justice system's response is yes, gender blind, but in fact it isn't gender blind. It's based on men, and you see that reflected in youth justice. However, we are also not listening to young women and girls, and not and systemically marginalizing them throughout the beginning of their lives, through young age, and later on through the schools and education system, the way we've set up services, whether it's youth services or violence against women and girls services. And it's great to have great examples of the women and girls in some of the work we do and some of our other partners in the sector, but it's very limited. It's encouraging to see from London's response to projects like the Courageous project that we're working, advanced works with women and girls with support of MOPAC, and I see Jane Lemon's on here, so shout out to Jane and the team at MOPAC. And it's something that we can build on. We're still responding in terms of either sexual violence or domestic abuse, and I completely would stress Nicole's point of young women and girls, and women later on experiences, are not as victims, as survivors, as offenders, as sexual abuse victims, as childhood abuse victims. They are complete human beings with multiple experiences, all of which form the whole picture. And we have to, as Nicole says, adjust the system to respond to them in a whole way. And so the coordinated community response that was, championed in this country by Nicole and our founders Bear and Beryl, and standing together, and the whole system approach that has become more and more a language in the conversation in the last few years, it has been a great step forward. So to the person who asked the question about have things changed, yes, they have, as Nicole has highlighted, and there is a lot more to go. So yes, we've made progress in battling systemic inequality and discrimination of women and girls, but we invite the other 50% of the population, so the boys and the young men and the men, to be part of this journey and to be part of the change, and not just at the system, but right through what we do. Nicole very much gave us lots of opportunities of what we could do to contribute, and I'm mindful of the fact that of the many participants we have, some that are in the sector, some that are not. Many of us would have been, will be survivors and will be experiencing domestic abuse, sexual violence, childhood abuse. So for those who may want to reach out to services and support, please look at our website, advance.org.uk, and we can put you in touch with, if not ourselves, other organisations like Women and Girls Network and other organisations that may support you. So please do so. And for those that are asking themselves, I'm not in the sector, I'm not on the front line, what can I do? We all have a voice, and I think Pippa very rightly said, until and unless every single time the conversation comes about any issues around violence and abuse and marginalization of women and girls, we call it out, and we ask for change, and we don't tolerate it, and we don't accept it, and we invite everybody to bring about change, then this is going to be a very slow process. So to Nicole's words, and that's Nicole Walsh, we do celebrate the resilience of women that have come before us, and young women that have come before us, women that are here today, and there's many on this panel and during this event, and many who are participating and within our organizations, and every single woman and man who battles violence against women and girls, and battles discrimination and inequality, because that is how systems change, by changing society, by changing ourselves, by changing everyone around us. So a final thank you to all of our panelists, to our speakers, and to MOPAC, and Sophie, to Nicole, and the DA Commissioner's Office and her team, and to everyone at Advance, and our service users and peer mentors, women with lived experiences that ground us every day and very bravely share their experiences and battle on, and really have some incredible inspirational lives and achievements alongside the trauma, not despite it. They're full people, and we salute every single one of them and every one of you. So thank you for joining. All of the slides and reports will be available on our website. So that's www.advancedcharity.org.uk. The report will be under resources, and at the event you'll be able to watch the recording of this panel. For those who have missed it, it'll be on our YouTube channel. And if you want to keep in touch with what else is going on with ourselves, you can sign up for updates in our newsletter. So again, this is the start of a conversation, not the end of one. So a long 2 hours, everyone. Have a lovely afternoon, and thank you.